continuing her activities. Now I would like to leave the floor to Dr. Aynur. Good morning, everyone. Thanks very much for coming. Today I'm going to talk about the topic of women with autism. Is there any difference when the women are autistic? And there's a difference, but to what extent we are aware of it. I'm going to discuss through this. I'm going to talk about its dimensions being dealt with within the literature, research, and its reflection on our clinical practice. Do we have any child psychiatrists? Most of the audience is the adult psychiatrists. Autism is very difficult to spot, especially with the people who do not have mental problems. As the adult psychiatrists, when we see the patient, we have the question marks. Does she have autism? But this is only at the bottom of the list, this probability. Our number is not huge, but I will start with a very simple thing. Please imagine an autistic person. I want you to imagine the image of autistic person. How many are we? 6 people. Now then, please imagine a patient with an Asperger syndrome. No, we are 8. Not 6, including the moderators. Now think about a person with Asperger's syndrome. Now first question. I asked, imagine a person with autism. How many people imagined a woman with autism? Can you raise your hands? Asperger's, woman, 1. As we have all witnessed, autism, we always think autism as of something peculiar for males and as if there could be no autistic women. Female autism profile does not exist in our minds, in our clinical practice. We have witnessed this once again. Of course, there's some truth in it because autism is more frequent with the males. Why did I base my presentation on the gender difference? You know, gender is a risk factor in the psychiatric disorders, and you all know that women are dealing with the internalization group disorders like the anxiety and depression. And in the males we have the externalization, substance abuse, antisocial personality disorders are more frequent. So gender could be a risk factor alone in the psychiatry. But in the autism spectrum disorders, it is more emphasized. In the literature, there are some different values. The rate of men to women is 4 times more. For every 4 autistic males, we have 1 autistic female. Autistic is a somewhat prejudiced term. We are using people with autism. When you're talking about Asperger's syndrome, together with the DSM-5, this diagnosis has been eliminated, and it is 10 times more in men than females. In some researches, it is shown to be 17 times more frequent in males than in females. Why is it important? Did we discuss everything about autism so that it's now gender's turn to be discussed? There are 3 core symptoms of autism: social communication, social interaction, and problems in the social communication, limited repetitive activities, interests, and behaviors. It is characterized by these 3 elements. It's a syndrome in males and females. In order for us to be talking about autism, there should be problems in these 3 core areas, and without these problems it's not possible to diagnose the patient with autism. Autism is a spectrum. There are an individual in the polars of the spectrum might vary, might look very different from an individual that is in the opposite pole. That's why it's very difficult to diagnose, and it may have a different impact on different people. Like some people socially they may be good, but in terms of communication they may be having any problems. When you have a look at their interests, it may be very good. There may not be any limiting repetitive interests, but they may be having some problems with the social interactions. Together with the DSM-5 criteria, it became very difficult to diagnose the females. DSM-5 accepts this, especially non-mentally retarded women. The symptoms are more faded. That is why it is very difficult to recognize the women with autism, and they can continue their lives without being diagnosed as autistic. To what extent we can provide services for those women who are openly diagnosed as autistic, so that we should start preparing services for those who cannot be diagnosed with autism. People should know the sources of their problems. It's a neurodevelopmental problem, a lifelong problem. It is having an impact on the interaction with their societies, and if it is ignored, they receive various diagnoses. Anxiety disorders, social anxiety disorders, personality disorders are sometimes used as a diagnosis for such kind of people with autism. And if they start to know that the source of their problems is something different, then they feel more comfortable. In the West, they spend a lot of time to diagnose people with some unclear symptoms. They sit together, they carry out multidisciplinary evaluations, because once they are diagnosed, they are going to receive various services from the state. Especially, there are lots of aids, assistance provided to such kind of people during their educational lives. We need to adopt this perspective somehow in our country. Now, diagnostic evaluation processes. What kind of gender problems do we have? We have the autism diagnosis scales. Some of them are translated into Turkish. When you have a look at the scaling studies, there should be 70 males, 30 females. At least 3 times more males than females should be your group. Then this is the question. This instrument, this scale that is standardized upon males, to what extent could it be valid for the female? Because females may show different symptoms in order to present their disorder. Now, this question is becoming frequent in the world of autism. Should we form different diagnostic criteria for the same disease, or let's use the same diagnostic criteria, but our cutoff points may be different for the males and females? Like, you make a separate evaluation for the boys and girls in terms of their body mass calculations. As we do this, we can also could we also do the same thing for the autism? In some research, the prevalence is thought to be 1 to 68. Now, some studies started to say that is the prevalence increasing, but to our best knowledge, it's more prevalent in males, from 4 times to 17 times. And it looks like as if the females need an extra pathology to develop autism. That's why the women with autism have also mental retardation. genetic symptoms or other pathologies should be present so that they can develop autism. There are some studies on the female protective model. What protects the females from becoming autistic so that female gender is protected against autism? Another theory says that autism is the extreme male brain. When I first started the neurodevelopmental psychiatry training, I heard this from one of my professors, Simon Baron K. or Baronka. In a period where the state refused to provide assistance for the autistic disorder patients, he started the service. My first supervisor was an Asperger professor. He was trying to normalize the case. That was what I thought, because he was an Asperger's individual. But Simon Baranka says that autism is an extreme male brain, and he sent this tweet. In 80% of the females with autism, we see the male brain, and with male brains it is intrauterine life. It is explained the women are facing with testosterone, that's why it is created. This is how they defend their thesis. In autistic spectrum disorder, the brains are hypersensitized. They have a brain that is more tendent towards the classification, hypersystemization, categorizing, classification impulses are more developed. If you have an individual with mental retardation, they have the urge to collect the buttons, the plastic bottles, papers, the tendency to categorize and classification. If you have an high IQ autistic person, then he wants to have, or she wants to have, this obsessive impulse to accumulate all the information in the field of history. Sometimes they make some jokes about the Oxford's mathematics department being full of autistic personalities. In the fields where there's a need to have systematic information, autistic individuals may act as gifted individuals, and they are very loyal to the routines, and this loyalty is also finding its basis on the impulse of making categorization. Hypercategorization is a tendency of the male brain, and their ability to empathize is lower than the females. On the one hand, they are capable of systematizing, but they lack of empathy. What is empathy? Being aware of the opposite individuals' feelings, finding the cues and coming to some conclusions, and being aware of the social hierarchy. This is a different perspective for autism on the basis of gender. In terms of the scientific studies of autism, yes, as we have talked, you need to have 3 times more males than females when you are to prepare a sample group. Not only in terms of the scale development, in the other studies, like to what extent SSRIs or antipsychotics are useful in the autism. In such kind of studies, the number of males are higher than females. Therapeutic modalities, again, males are high in number. Social service project developments, rehabilitation projects, the samples, a high majority of the samples are consisting of males. The mental differences in terms of IQ, I have already talked about this. When you have autistic individuals with high IQs, high intelligence, such kind of individuals are males more than females. Are there some common genes or overfolding genes between the mental retardation and autism? But this field is not very well developed, so we don't have mature conclusions. Now let's come to the issue of autism. In males and females, what kind of differences do we have in what fields? In general, female autism is more perfectionist, is more determined, and is straight-headed. When they are playing with the males, they are more controlling in that sense. Their flexibility is lesser compared to the males. What kind of differences do we have with the autistic movement in terms of the social communication? They are more aware of the necessity of the social communication compared to men. So the necessity of starting a social relation and sustaining it, this awareness is higher in the women. Why is it important? The families most of the time say they have friends. They make friends. This is important to diagnose if you have a female patient. But when you look at the play groups, they are passive. They cannot start an active social interaction. They are waiting for somebody to come to them and get interested in them. They are somewhat shy. Since they have awareness and they have demands in order to show themselves in the social environments and to stick to the social norms, they are copying the other people, imitating the other people. You are aware of the situation, think about that. And you, in order to get adapted to the social environment that you are in, you are observing the people continuously. Let me behave like them so that I don't look weird. It's a very tiring process for them. By masking the difficulties, they are adopting kind of compensation strategies. When you ask the family, for example, does she have any friends? They may say, yes, a couple of close friends she has. In the autistic individuals, the concept of friendship is not very well developed. You need to question the details, but on the surface you can say that there are a couple of friends. In the primary school, since they are very shy, they are more protected. A dominant character guards them. In English it is mothering. They are mothered, but in the elementary school, in the high school, they are subjected to the peer bullying. Their linguistic capabilities are better and they have better imaginations compared to the male. They can play some fictional games. Like, do they hold a toy? Are they using it as a real doll? They may say yes, but when you go into the details, you will see that this play is repetitive within itself, as if they memorized something and continuously repeating it. Rather than mutual plays, rather than an interaction, they would like to take the control, as if they are playing alone, despite the fact that there is somebody next to them. We should not ignore this. And let's come to the repetitive, limited fields of interest, the third core symptom of autism. Most of the time, males are attracted towards the lifeless, inanimate objects, but in the females, it's more lively toys, and for the first time it may look very normal, so it may be deceptive. It may look non-autistic. Now, the age of diagnosis. Because of the camouflaging, masking abilities of the girls in terms of their autism, they are diagnosed on the later stages. The most important psychiatrist behavior problems are the most common symptoms in such kind of autistic individuals. But when it comes to the girls, they are attracting their parents' interest less in terms of this, so they are brought to the clinics in later stages. In the Western society, in our society, people are educated, grown up to be more empathetical, to be more harmonious with the society, so they are recognized only in the later stages. In the West, they are trying to identify the pink in the spectrum. How can we identify the females? They are trying to go into the details of spectrum rather than diagnosing the autism as it is. But post-diagnosis, what happens? It does not end there, because females are experiencing this disadvantage because they are different than their own peers. Like women with autism are different than the women without autism, and they're also different than the autistic males. That's why they experience more problems. The special training or educational environments that are formed for them, most of the time in such kind of environments there are 8 males, only 2 females. So during their childhood they have less social environments to develop, to advance, improve themselves. Longitudinal studies are not carried out for the autism individuals. What happens to them after a certain age? There's only limited studies, but according to what we have, female autism patients are more isolated, and less number of them received proper training compared to the males with autism. Unfortunately, on both sides, my conclusions were deleted. So as a result, they are either not diagnosed or diagnosed only in the later stages. When you look at the samples, you need to be able to present the different presentations, and you need to at least have 50% males and 50% females. Not only the caretakers, but also the caregivers' demands should also be paid attention in order to develop such a system that does not disadvantage to the females. These are the topics that we have already mentioned. Thanks very much.